Team 26's business idea is called MedicPic, which is simply breaking medical language barriers using pictures. So why MedicPic? We have identified a problem. This is through our clinical work in emergency departments. We have found there is the misdiagnosis and ineffective treatment provided in emergency departments due to language barriers between doctors and patients compromises patient safety. The current solutions are either expensive, such as language line, whereby a doctor will use a professional translator over the telephone to communicate with the patient, or MediBabble, which is a one-way patient communication application which allows doctors to understand to a limited extent what a patient's problems are and does not allow for fluid two-way conversations. Therefore, there is an unmet need for a cost-effective medical translation app which will facilitate two-way communication to overcome language barriers between a doctor and a patient using visual clues, and that is where MedicPic comes in. So effectively, MedicPic is the use of visual cues to guide a patient and a doctor through a structured clinical pathway for a particular symptom, such as chest pain, stomach pain, or vomiting. There will be a specific clinical pathway for every common presenting symptom that you see in the emergency department. There will also be pathways, again using visual cues, to guide patients through the treatment of their symptoms and also through the discharge process or the admissions process if it turns out the patient needs to be admitted to hospital. This will facilitate safe, high-quality care to be delivered in a time-efficient manner to patients that do not speak the same language as the doctor treating them. Here is an example of the application in action. So the first screen that the patient will see is the choose language option. And in this case, the patient has chosen Chinese and the doctor speaks English. We will then see the second screen where we get a list of problems and we have to choose the problem. You can see here that there is text, there is Chinese to English text translations as well as pictures which are, we hope, quite easy to understand. So in this case, the patient will click on the pain problem and they will then get this icon with the two big pictures of the human body, and they will use an arrow to point to where the pain is. So you can see that the patient does not need to communicate verbally anything to the doctor here. They can just point to the part of the body on the screen. The next question will be whether the pain was sudden or gradual. And again, we have some visual cues to help the patient communicate to the doctor what the pain was like. And there are then about 20 further questions which follow the same format of text translation and also visual cues in order for the doctor to fully understand what problems the patient is having. There are two key customer segments, patients and physicians, and this application will have to be easy to use for both of these segments. The target markets in the first instance will be hospital emergency departments and urgent care centres, both of which have high prevalence of patients who do not speak the same first language as the doctors. In terms of revenue stream, there will be two pricing models. The more common model, we believe, will be subscription-based, whereby a hospital will pay about $1,000 per year and will be able to use the application an unlimited number of times on an unlimited number of devices. There will also be a pay-per-use model for smaller hospitals who do not want to commit to the $1,000 outlay in the first instance. They can pay about $5 to $10 per time that they use the application, and if it turns out that they like the application, then they can be moved on to the subscription-based model. We expect our initial costs to be quite high in order to develop and refine the application software, but the subsequent running costs will be relatively low and will mainly involve maintenance of the software for individual hospitals. The revenue streams will pick up during the first 3 years. We hope to be breaking even by about the end of year 3, beyond which point we are hoping to make about $100,000 to $200,000 worth of profit each year. Here is a brief background to Team 26. We have a mixture of PhD, MBA, and medical doctor and information technology experience, which we hope will bring a well-rounded set of skills to develop this application. Thank you for your time.